up? It's a medical week here on the Morning Blend. All week long, the dedicated professionals from WellHealth are bringing us interesting and relatable health information that you can apply to your own life.
That's right. Joining us this morning is Dr. Warren Volker. He is a physician with WellHealth Quality Care, and Meghan Bailey. She's a public information officer for WellHealth. Welcome to the both of you.
Good morning.
Good morning.
So I've been seeing these billboards for WellHealth all over the place now. For those who don't know, what is WellHealth?
So WellHealth is a multi-specialty accountable care network, and we are made up of some of the highest performing physician groups here in Southern Nevada.
And let's talk about our health here. Do you find that a lot of people are more interested in taking care of themselves, doctor, and trying to be more healthy?
Yeah, we see people who really are just starting to take ownership in their health care. One of the biggest indicators, I think, is iTunes app stores, how people are downloading more and more apps on their smartphones and their iPhones to learn more about their health care and what they can do to help their physicians.
No question. Well, actually being able to figure out exactly what it is I'm eating and how many grams of fat are in that sandwich, wow, oh my God, I'm shocked. I think people are starting to do that more and more. Healthcare reform. How is WellHealth and healthcare reform aligning? We have a graphic of some of the costs.
Yeah, if you look at it, is the United States, showing on that graphic right there, is on the left side of the United States. The United States spends the highest per capita per person when the World Health Organization compares to other countries. We spend over $7,000 per life per year. And other countries, when you compare, like Italy or France, they spend less than half than we do.
Wow.
And yet we are challenged with a lot of our ratings in the world as far as how good our healthcare system is.
Mm-hmm. And what steps is your organization taking to prepare for changes people are making?
Well, what WellHealth really is we have clinics from women's health clinics to metabolic clinics to surgical clinics, and we're integrating healthcare through technology. Part of the healthcare reform this year going into next year is to link information, to link patients' charts through the Health Information Exchange that Nevada put together a year or so ago, and really making sure that that patient has information and us as physicians have access to their information.
Absolutely. Now, Meghan, let's talk about access to these physicians. How easy is it to access a WellHealth physician?
Accessing a WellHealth physician is really easy. The best way to do it is to head to our website, wellhealthqc.com. There you'll find a list of our featured members as well as our clinical centers of excellence. When you find the care you're looking for, you just call their offices directly to schedule an appointment.
Awesome. And it's nice to be able to find someone that can treat what you're looking for.
Yes.
So let's say if you want to lose weight, you can talk to a specialist, and that's
Correct.
what you talk about when you're talking about affiliated health and physicians.
Yes.
Is that correct?
Well, why choose a WellHealth affiliated physician as opposed to anyone else you see out there?
Okay, so choosing a WellHealth physician is like choosing a product with the Good Housekeeping seal of approval. So what our Quality Assurance Board has done is they have not only brought clinical data to the table, but also patient satisfaction. So things that are important to us, you know, am I getting in and out in a reasonable amount of time? Can I get a same-day appointment? So they take those two measures and they put them together, and they do frequent checks on our WellHealth members to make sure that they are adhering to the standard of care we put forth.
I get that. And the patient obviously benefits in that way too, so they have the access to the information and they know that you're taking care of them in the best possible way as well.
Yes, it's always about the patient.
How do Southern Nevadans rank health-wise compared to the rest of the nation?
You know, that comes up all the time. Do we have good health care in Nevada, and specifically in Southern Nevada? And the answer is yes. I mean, we have excellent physicians. We have excellent hospitals. We have access to some of the best specialists, subspecialists in the country. Where we're lacking is maturity. You know, Las Vegas has grown so fast, and it's a lot like our education system. We have good schools and all that, but it takes time to interlink and to evolve those systems.
And let's talk about some of the specialists again that you guys have in your network. Can you tell us about that?
Yeah, well, we have right now 4 clinical centers of excellence. We have WellHealth Anesthesia Associates, Las Vegas Minimally Invasive Surgery and Women's Pelvic Health Center, WellHealth Women's Specialty Care, which may sound familiar. They've been in the Valley since 2001. And our newest center, the WellHealth Center for Metabolic and Hormonal Medicine.
Awesome.
So one area can refer to another area and work together, sort of an integrated system.
Awesome. If they wanted to learn more about WellHealth, how do they do so?
They can head to our website, wellhealthqc.com, and they'll find all the information they're looking for.
Awesome.
All right, great.
All right,
Thank
we'll
you.
speak to you in a little bit.
All right,
Okay,
perfect.
great.
Thanks.
For more info on Well Health Medical Care, check out wellhealthqc.com and keep watching because Megan and Dr. Volker will join us a little later with more.
Back to the blend. Our medical week presented by WellHealth Quality Care continues now to help arm you with the information you need to take charge of your health.
Back with us are Dr. Volker, a physician with WellHealth Quality Care, and Meghan Bailey, WellHealth Public Information Officer. Good morning and welcome back.
Hey, thanks.
Morning, thanks.
Now, doctor, for people who missed our interview just a little bit ago, explain to us about WellHealth Care and the care that you provide.
Sure. WellHealth Quality Care is essentially a physician-run organization. We started in women's health care with women's specialty care clinics and expanding into surgical care, anesthesia, and other services. And essentially, when patients are accessing physicians, they want to know, where do I find other good doctors? How do I connect with other doctors? And with WellHealth, you go on the website and you can find the physicians that we refer to, people that we trust, people that when you go to one of our specialists, they'll refer to another physician.
So you have pretty much everything from general practitioners to subspecialty care.
Yep.
Correct.
Now, the way that WellHealth works, it's really an innovative way to provide care. How does this help the doctor treat the patient more effectively?
Well, the more communication we have about the patient, the better. We've been working in silos. Patient goes to one physician for one problem, and we have to almost start over like where that patient's care has been. And that's why when you go to the physician's offices, you continue to fill out the same paperwork. You continue to do, we repeat a lot. And
Repeating things in quadruplet. Yeah.
Yeah, and we're really moving towards that virtual interconnection with the Health Information Exchange that Nevada has put up, Healthy Nevada, that we're continuing to evolve and work with.
And you guys also have WellHealth Clinical Centers of Excellence. What is
Yes. So we have 4 centers right now. We have WellHealth Anesthesia Associates. We have a Las Vegas Minimally Invasive Surgery and Women's Pelvic Health Center. We have WellHealth Women's Specialty Care, which has been in the Valley since 2001, so it may sound kind of familiar to everyone. And our newest center, which is the WellHealth Center for Metabolic and Hormonal Medicine.
And we'll be talking more about that tomorrow
Yes.
as our medical week coverage continues too.
Absolutely. I know that here all this week on the morning plan, we're going to be talking about that. We'll be hearing about one specific aspect each day about the comprehensive care that WellHealth can offer.
Right. Well, this week we'll be hearing from the WellHealth Center for Metabolic and Hormonal Medicine. Dr. Donald Tice will be coming on to speak with you. There are some symptoms that maybe people believe are just old age or menopause or things that are out of their control. Yeah, and sometimes they're not, and sometimes they can be treatable. So he'll be bringing that to you, and it'll be pretty exciting.
And doctor, when people come to you to get help, what's the #1 concern that they have? What are you hearing?
Most of all, I think patients are really concerned about future care. It's interesting, we can take care of their problem today, but there's a lot of unrest of what's healthcare going to look like, and it's constantly changing, and just like us, we're evolving with Obamacare and the changes and the impact. Patients are, is my employer still going to cover me? What's going to happen with Medicare, Medicaid, and a lot of unrest with patients.
And you're staying obviously on top of that issue because it affects you so much.
Yeah.
Correct, yeah. And what I can assure patients is that healthcare as you know it, even though it's evolving and changing, I think ultimately it is going to get better. I think the future is brighter. And the emphasis is going away from not just the delivery of healthcare, but how the patient perceives it. Much more focused on the patient, much more focused on the satisfaction of the patient. And that's where we are, is never before has there been so much focus on how does a patient feel about their care and what's important to them.
Absolutely. I mean, it must have been so frustrating for doctors not being on the same game plan as, say, the other specialist that they might see or the other doctor that they might see. With the information exchange and little moves like this, healthcare is getting more person-focused.
Correct. Yeah, and you know the real fact is that we've got to step up our game as physicians. I mean, we've got to work better in partnership with our payers, with employers, with unions. We're already connected with our hospitals. We're connected with each other, but we've got to share that. We've got to break down the silos. And you know, with our women's centers, we have 10 locations around the city, and we have patients that work in one area of the city, they live in one area of the city, and the fact that they can go across the city and access a provider at convenience when it needs to, but also see their one physician that they trust, that they've been seeing for the last 10 years. And that's what we need to do. We need to really maintain that physician-patient trust and that ongoing relationship. And that's really what we're all about.
Absolutely.
Thank you so much.
Thank
Pleasure.
you.
We'll see you tomorrow.
Yes.
Thanks.
Right, for more information on WellHealth Quality Care, check out wellhealthqc.com. Watch the Morning Blend all week long for more medical tips.